Okay, let's talk about the anatomical spaces of the upper limb. And as we do, we're going to answer a few questions like, what are the borders and contents of the quadrangular space, of the triangular space, the triangular interval, the cubital fossa, the anatomical snuff box, and last but not least, the carpal tunnel. Let's start by talking about the more proximal spaces. The first one we're going to do is the triangular space. So looking at this posterior view of the scapula, I see here we've got the teres minor, then the long head of the triceps brachii, and then teres major, and that is forming this triangular space right here. So we'll label it triangular space, and then I'm just seeing one artery passing through, and it looks like it's probably supplying these muscles in the area, and it's wrapping around the scapula. So that is the circumflex scapular artery that's found in the triangular space. The next space we'll do is the quadrangular space. This is a nice square rectangular space, has 4 sides. And so the borders of this, again, we're seeing the long head of triceps brachii, teres minor, the medial portion of the humerus, and then teres major right here. Within the quadrangular space, I'm seeing 2 structures. That is the axillary nerve that's wrapping around the surgical neck to innervate teres minor and the deltoid, as well as the posterior circumflex humeral artery. And then our final space is the triangular interval. We're seeing that here more inferiorly, and the borders of that are teres major, long head of triceps brachii, and then the humerus. The structures found within this triangular interval are the radial nerve and the profunda brachii artery, or the deep artery of the arm, and then those are going to wrap around the radial groove of the humerus. And that is it for these proximal spaces, so now let's move to the cubital fossa. The term cubital is just used to describe the elbow area, and this we're going to see another triangular shaped space right here. So the borders of this fossa are the superior border is kind of this line between the epicondyle, so medial epicondyle, lateral epicondyle, so that's the superior border. And then from there, we've got this muscle here, that's the pronator teres muscle. And then when we're getting our more lateral border, that's going to be the brachioradialis muscle right there. And then the roof of this fossa is this structure right here. We're going to call that the bicipital aponeurosis. So we'll add all of those structures to our table here. And then I just wanted to highlight again the space. So it's kind of a triangular shaped space right here. Next, what we're going to do is remove some of those more superficial structures to see what's within this fossa. And so the first structure we're going to see here is the radial nerve. So we know the radial nerve innervates the posterior brachial and antebrachial compartments, but it has an interesting pathway for a second where it comes a little bit more anterior before going back posteriorly. So radial nerve, we also see the biceps brachii tendon as it's inserting on the radial tuberosity. Also here we see the brachial artery where it's splitting into an ulnar artery and the radial artery. Finally, we also see the median nerve here. So those are all of the contents of the cubital fossa. We do not see the ulnar nerve because that loops posteriorly behind the medial epicondyle. So now let's add all of those structures here to our table. And that is it for the cubital fossa. So now let's move distally and talk about the anatomical snuff box. We can see on this image of the lateral right wrist that the anatomical snuff box is highlighted here. So we're going to figure out the borders. The first one I'm seeing is this tendon here. And as I'm following it, it looks like it's going to the thumb, that it would extend the thumb. Another tendon as well I'm seeing as a border. This tendon also going to the thumb looks like it would extend the thumb when it shortens. So this first one's a little bit longer, so we're going to call it extensor pollicis longus. The second tendon that's also a border, a little bit shorter, so we'll say extensor pollicis brevis there. And then with extensor pollicis brevis, we have an even shorter tendon, but that's just ending here. It doesn't look like it's actually going all the way to extend the thumb. So this tendon we're going to call abductor pollicis longus. With those now labeled, we will add them to our table. Some other ones that I didn't label, the proximal border is the styloid process. So we're seeing that right here of the radius, the radial styloid process. And then the floor of the anatomical snuff box is the scaphoid bone and the trapezium bone, so 2 of those carpal bones. The scaphoid bone is vulnerable to injury from falling on an outstretched hand or a Fuchs injury, and so it can actually be palpated in this anatomical snuff box. Now that we know the borders of the anatomical snuff box, let's look at the contents. So within here, I'm seeing this artery. It's on the radial side, so it's got to be the radial artery, so one of the places that can be palpated. And then we also have this nerve over the top, and so this is actually a branch of the radial nerve, and it's the superficial branch of the radial nerve. So this nerve is just doing sensation, and it's mostly of the dorsum of the hand, the first couple of digits, and the thumb dorsally for sensation of that skin. So we'll add those structures to the table. Some resources also list the cephalic vein here coming over the top of the snuff box. I didn't list it, but just be aware that some resources might. Moving on, the last space we're going to talk about for the upper limb is the carpal tunnel. And this, I would guess, is probably the most common, and you've probably heard of this one. So the borders of the carpal tunnel, here we've got the carpal bones, and then we also have this flexor retinaculum. So this is a band that keeps all of the flexor tendons held down basically against the carpal bones. And so we'll add those to our table here. So borders carpal bones, flexor retinaculum, and then we're going to switch to this image here to see the contents. We've got a lot of tendons running through the carpal tunnel, and it's basically going to be all the tendons that flex the digits. So from flexor digitorum superficialis, we have 4 tendons. So 1, 2, 3, 4. And then we also have 4 tendons from flexor digitorum profundus. So 1, 2, 3, 4. And then we have this last lonely tendon and that's got to go to the thumb, so that is the flexor pollicis longus tendon. With all of these tendons, we also have a nerve here. This nerve looks like it's more on the side of the thumb than it is over on the ulnar side, so that has got to be the median nerve. So with that, we will add all of these structures to our table. So again, we've got 9 tendons. They're all going to the digits originating from the forearm, and then the median nerve. And so a lot of times what may happen and why this is clinically significant, if there's any inflammation going on in the carpal tunnel, this is a really tight area and there's really no room for expansion. So these tendons can potentially rub or compress the median nerve and cause issues with the median nerve. So we would see that affecting mainly the thenar eminence, so a lot of these muscles, as well as the first lumbrical and the second lumbrical. There may also be sensation loss to a part of the thumb as well as the second and third digits. The last thing I wanted to point out on this image is the ulnar nerve. So it does not go through the carpal tunnel. It is right here, and it is passing through an area called Guyon's canal. And that is it for the carpal tunnel. So let's do a quick review of everything we've gone over. So we learned the triangular space houses the circumflex scapular artery. The quadrangular space has the axillary nerve and posterior circumflex humeral artery. And then the triangular interval has the radial nerve and profunda brachii artery. The cubital fossa is a triangular shaped space in the elbow, and that houses the radial nerve, biceps brachii tendon, brachial artery, and median nerve. The anatomical snuff box is found between some of the extensors of the thumb as well as a thumb abductor, and it contains the radial artery. The superficial branch of the radial nerve runs over the top, and then we can also palpate the scaphoid bone in that space. Then finally, the carpal tunnel contains the 9 tendons from the forearm that are going to the digits, so 4 from flexor digitorum superficialis, 4 from profundus, and then 1 flexor pollicis longus tendon. And then we also have the median nerve within the carpal tunnel, and it can be compressed. It's an area where it's likely to be injured and cause issues with the thumb and the second and third digits. And that is it for this video on the anatomical spaces of the upper limb.